intro. My name is Jonathan, Dr. Grindley, and I'm the medical director for Ralph Avenue, which is a veterinary hospital, a hospital and a veterinary emergency group located in Brooklyn. The name of this presentation is but it's called Culture slash You, and with the focus of this presentation being just how some different facets to workspace culture, some different things that are kind of really important to consider as well. And I'm also going to draw on experiences that I've had throughout my career to kind of highlight those points. But this will be a bit interactive, and so I'll be throwing some questions out. So first, I would ask everybody to kind of turn their cameras on just so we can see everybody's faces. And if there is any feedback to any of the questions that are asked, feel free to jump in. So yeah, once again, I'm Jonathan Grindley, native New Yorker, kind of born and raised here. My parents are both Jamaican, and I'm a first generation American. They moved here when they were in their early 20s. And yeah, did their best by us. Mom was a nurse, dad was an elevator mechanic. It's a love story. I went to Tufts University and graduated in 2014. And yeah, since then had, a few years in emergency medicine, had a couple of deviations, played with dolphins for a year and a half, but always found my way back to emergency. And I've worked in San Diego as well as New York, and currently in Brooklyn. Once again, I'm the medical director for VEG Ralph Ave, also called VEG Rave, just sounds better. And I've been in this position since December of 2019. And I guess we'll start with just talking about culture. I feel like the word culture is really thrown around often in a lot of different conversations involving everything from vet med to music, entertainment, everything. But what comes to mind when you think of culture? What does it mean to you? Or even like a workspace culture, if we're going to narrow it down. Like when you think about workspace culture, yeah, what ideas come to mind, what feelings? That for me, I had to really think about what culture meant and like how I would define it in a way that kind of captured it across categories. Um, and it's really a difficult thing to pinpoint as well. But even deeper than that, if it's difficult to define kind of what culture means to you, I found that for me, it's also difficult to define like what my impact is on culture. Um, and admittedly, when I'm feeling really insecure about definitions, I just go to the dictionary. And like the definition of culture is like the attitudes and behavior characteristics of a particular social group. Um, so that is, what it's an accepted way of operation by a particular group of people in whatever category or in whatever space. And it's hard for it to be determined by an individual unless the general group offers the individual the right to do so. And when I was thinking about culture and one's impact, I kind of broke it down into four principles. And I'll admit, I just made this up. Like you won't find this in a book or anything. It's not that deep. But when I think about culture, I can break it into four categories or four like ideas or principles. That culture is intangible, culture is internal, culture is inconstant, and it also has to be intentional. And the first one being intangible, the intangibility of culture, uh, it being difficult to describe, to touch, to feel, something that you might not necessarily understand that you're in the midst of until you're feeling the effects of it. But question to the group is, have you ever walked into a space and felt kind of an eminent toxicity or felt naturally welcome? And what made you feel that way in either direction? Like I've walked into cultures, and I'll give you an example in a moment, but even as Avery was giving her example, I was thinking about what an owner might encounter walking into a hospital and just experiencing that culture for the first time. So at veg hospitals, we might see a couple of shameless plugs throughout this presentation, but yeah, but in my hospital, just with the open model that veg has, and that other hospitals are adopting, but the format where an owner walks into a building with their pet and finds themselves immediately in the treatment area, subject to the culture of that space, the energy of that space. Um, how we present ourselves on the floor to each other and to our clients, to our customers. is really important. A lot of the nuances of culture that might exist in a hospital are felt before they're are felt before somebody has the ability to describe them. And like even as like, and I'll give you an example here. Um, with me walking into, and just a little backstory, I mean, I mentioned San Diego earlier, a little bit of a segue. But when I was working in San Diego, I was working at a hospital called VCA El Cajon. And VCA El Cajon, as you can see, is a little marker in the top right corner of that map. And San Diego proper is more towards the mid and lower left. Um, and it's a very profound demographic change as you go from one area to another. El Cajon was a really marginalized community. There's primarily black and brown people there. Demographic primarily, I would say at that point ranking about like 30 to maybe 40% of that demographic consisted of black and brown people. Most of the doctors, myself included, admittedly, were driving from San Diego to work there. But a lot of the support staff lived locally within, I don't know, a couple of miles, and some of them didn't own vehicles, so they were kind of public transportation or however, but they were of that community where, as a support staff, compared to the doctors who weren't. And I'll say that right there, and this is the thing that I've noticed between hospitals as well. If there is a big cultural difference between or demographic difference between the doctor's team and the support staff, that can already create a culture of kind of disconnection. Where you don't really have a great understanding or even a great ability to communicate orders or sentiments or empathy even. And the doctors might often bring if you're not careful, a different energy from the staff with regard to client care and communication. And admittedly, this hospital, and I started out there as a relief doctor and eventually joined the team as an overnight doctor. But when I would walk into this hospital, like the air was like thick with tension. There was an obvious disconnect between the doctor's team and the demographic that they served. And that kind of toxicity kind of trickled down into the support staff as well. The support staff kind of feeding off of or feeding off of the kind of negative, I mean, even dismissive disconnection that they were feeling from the doctors. I mean, all of that was translated or transferred rather onto the owners who came with their pets. Um, and I mean, admittedly, this wasn't necessarily something that I had the tools to change at the time, but I would learn that the immediate effect wasn't something that I was easily able to identify. Like I could feel that there was a negativity at this facility. Sorry. And I could feel, I didn't really identify, well, I could identify it as toxicity, but the core reasons behind it were difficult to isolate. And as I developed as a leader, like further on in my career and deepened my tools, it became easier to guard against kind of this type of energy and even kind of steer it in a different direction. Um, so at this point, I'm curious as well, like with regard to, and I guess especially regard to in regard to the differences in energy between the doctor's team and the support staff. Um, are there have similar experiences been felt from anybody in the group? And he's going on in one of the market hospitals now where they're not even aware. And I think that the awareness of one's impact, whether it's taking the patients to deal with somebody from a different culture that they're not necessarily familiar with, or shelving their own biases. I mean, I think it does start with awareness and understanding of kind of where you are, kind of where your sense of culture is, where your sense of impact is, and then from there you can kind of modify it as necessary to kind of best facilitate an outcome, especially in an emergency setting. But some people hit a lot of roadblocks and don't know how to get out of it because they haven't kind of gone through that period of self-awareness yet.
Yeah.
All right. That's a like alliteration. I'm going to go with the second one. Culture is internal. And I guess I'll lead off with a question here too. Have you ever felt at odds with the space that you walked into, and why do you think that is? And what grounded you in the moments that you did feel that way? I'll say that the I guess I'll even kind of go on it with my example. I'll call this also your internal compass, kind of what guides the way that you move and the decisions that you make and how you choose to interact and interface with people. Um, that's what I would call like my cultural compass. And with a strong cultural compass, you can kind of have a definitive way that you deal with people that isn't kind of shaken, disturbed, or altered by the environment that you're in. Um, and it's also internal, as I said, and it will either resonate or reject the cultures that you're kind of immersed in, the culture that's around you. So yeah, the question to the group is like, have you ever felt at odds with the space that you walked into? Like, what grounded you in those moments that where you felt like your cultural compass was at odds with the space around you? Yeah, yeah, and you bring up a really good point too. Is like with time, the like because another question that I had was like, what are the risks of not kind of following your own internal compass, or and not even following it? What are the risks of, especially long term, kind of being out of tune with your internal compass, being out of tune with the environment that you're in? Um, and one potential outcome is assimilation, which is like the absorption and integration of like you or your ideas into the wider society that you're in, or the wider culture that you're in. And that can be damaging because assimilation in a toxic work environment means you're becoming toxic in order to just fit in, or in order to
Absolutely.
logically to just yeah. And I think and really kudos to you for being aware and kind of doubling down, because I think what yeah, you're experiencing kind of a clash between your internal compass and the world around you and the environment around you. And I think in vet med especially, I mean, I've worked in, more than one hospital that had a subpar culture. And along the way, although I didn't necessarily have the tools to deal with it at the time, along the way, like learning kind of, I mean, I guess the one tool is like just developing a sense of self-awareness and deciding what you won't deal with moving forward, what you're unable to tolerate moving forward. And just to keep this kind of solution oriented, also like posing a problem and a solution simultaneously. There's some hospitals, or even generally speaking, in any hospital, the in order for the work culture to change, it has to start from the top down. So if you're in an environment where you feel really out of tune with kind of the culture of your hospital, and you feel like that's having a damaging effect, preventing it from being massively impactful on you requires like doing whatever you can to either try and change it or remove yourself from that environment. Um, and like I'm a medical director at my hospital, so I mean the culture kind of in a lot of ways starts with me and my leadership team. And a really important thing that we try to do on a regular basis is to just be attuned to how our team is feeling, and handle whatever concerns that they have, the reasonable ones, seriously. So yeah, I mean, it's like Lenny, it's like you approaching your leadership team and asking for change, or asking them to kind of pay attention to certain things that are going on in the hospital is the best thing that really anyone could do in that situation, and hope for change, even provide them insight, examples, even. Um, so that they can have a targeted response. And I think another targeted response is leadership. And I like, especially with you, like you'll be a doctor on the floor at some point soon. Congrats. But you'll be, whether it's like a shift change or you'll be on clinics, and you'll see you will be the leader in the moment on the floor. And honestly, Lenise, you should like everybody can be a leader on the floor. It isn't restrictive, but admittedly, there does a doctor does have a certain level of weight in controlling the tone on the floor and in a hospital at any given time. Like if the shift change happens and a really negative toxic doctor walks on the floor, it will have a negative impact on the team because they have to deal with this person. I mean, you have to deal with everybody, but you're taking orders from this person, you're routing communications with owners through this person, you are this person, I mean, and especially the doctor on the floor, like they're protecting you in some moments if owners are being offensive. I mean, there's really a highly integrated role in the hospital, in any hospital. So it's important that from the top down, any concerns regarding culture are taken seriously. And one thing you should always hopefully have the ability to do is to voice concerns that you have, regardless of what the outcome might be. And yeah, like the sad truth is like there are a lot of hospitals who are losing staff, especially in the emergency room, because they don't know how to handle necessary or facilitate necessary changes to culture, put the pieces in place, keep the people that need to be kept, and either reform or transition the people who are toxic. There are a lot of leadership teams who don't know how to do that or don't acknowledge the need to do that, and it is to the detriment of the team and ultimately the profession. But ultimately, like voicing those concerns when you are feeling something internal, when you are feeling angst or anxiety, is absolutely imperative. Um, yeah. I'll also say, switching slides. I'm gonna shout out my team real quick. This is the South Brooklyn. I keep calling it South Brooklyn because we relocated. This is the Ralph Avenue team. With culture, it's really important to do everything that you can to make sure that the culture is not even just steady, but cohesive. And that does require like having an idea of the contributions that everybody on your team has. Everybody brings in their own unique flavor, and hopefully, certainly from a leadership level down, the culture or the expectation for the cultural contributions of each individual is established. Um, and everybody's going to bring in their full self. And at VEG, say you're 97% perfect, and then there's that 3% that can warrant some tweaking, and everybody has their 3%. But cultivating that 97 and kind of steering that 3% for everybody on the team to make sure that they can contribute in the best way possible is ideal. So, and once again, like I'm talking as a medical director, but the doctors can have that same impact on the team. Like if somebody on your team has a concern, or if you're a lead on the floor, or even if you're not necessarily a lead on the floor, you can be an assistant, kennel agent, like it doesn't really matter. Like you have the ability to be present to hear and receive concerns that other people have and work on it in kind. Um, so yeah, just this takeaway here is just to make sure that just accepting the positive and the rest that everybody has to contribute, being willing to work with it, and trying to do your best to make sure that there's a cohesive environment. We're going to do the third I, which is culture is inconstant. So we spoke about this before, and this could be somebody walking in. This could be a shift change. This could be somebody walking into a room. But have you ever started a shift or just been around someone who negatively impacts the culture? And how abrupt was the shift? Like, have you ever like walked into, well, if you can walk into a room and you're received with an energy that's uncomfortable, but has anybody ever walked into a room and that person shifts the culture in the room? Has anybody ever experienced that? I can think of an example now. This happened. This maybe have been like a week and a half ago. There was an individual who walked, it was a shift change. And yeah, as a result, just this person's presence was impactful. And I think this happens at any facility where a doctor comes in and can change the culture, or at least the sentiment on the floor. Like the culture on the floor can become immediately more negative or positive, or even like lazy or go-getter. Like if the dynamics of each individual member on a team and that immediate culture is abrupt, then that can have a pretty stark change on the culture as well. Um, and what leads to an unstable culture is if there isn't kind of an overarching kind of steadiness to the hospital, the environment, the room that kind of pulls everybody together. And I'll say, like at my hospital, what we try and do is make sure that there's a general expectation on what we want people's professional impact to be and cultural impact. And as a result, if they're having a good day or a bad day, they know how they have to show up once they're on the floor. And also, as an aside to that, if there's a culture of kind of vulnerability, awareness, and even empathy, then these people can be confident that they can show up with their full selves and be received by an empathetic group. So although culture is inconstant, it's really important to also focus on the fact that culture can be inconstant in a negative or a positive way. And cultural change could either be stable, which, although, so despite being inconstant, it can have a steady change, a very gradual change if the general understanding on what the word culture should be is stable, or it can be volatile, which means there isn't kind of an overarching expectation, or at least not one that's enforced or followed. And therefore, the culture can shift with the wind, with somebody starting a shift, with somebody leaving. It can lead to some really kind of negative changes if you're not careful. And I mean, also like being sensitive to those shifts. And also I mean, especially on a team, as you spend a lot of time with each other. I mean, we pretty much live at the hospital. As you spend more time on the floor, you can learn what everybody's nuances are, what their triggers are, even. And it just kind of promoting a culture of like empathy and vulnerability, as I said earlier. You can the group as a whole can accommodate to that person and kind of decrease kind of their impact on any kind of shift in mood or culture in that moment, and also protect them and bring them into the fold so that they don't feel culturally isolated. So they don't feel like that person who walks into a room and everybody's quiet, or they don't feel like an outsider. So a healthy culture is also really inclusive. And that's just as an example. So as I said on the MD of Veg Ralph Ave, which is on the right, the Veg Ralph Ave was previously Veg South Brooklyn, which was an acquisition from this previous hospital here. And there are just some kind of notable changes on the how incons how culture can change in a way that's abrupt, but also in a way that's long lasting. um, VEG as a whole, veterinary emergency group, kind of, I would say, demands a certain nature of culture from all of its hospitals. And the leadership teams that are in place do everything that they can to not simply enforce, but kind of facilitate, foster, and kind of cultivate a healthy culture that's inclusive, both for the owners and the staff. But the transition itself can sometimes be pretty volatile. And I don't know if like, anybody who has been a part of a hospital going corporate or changing hands from one owner to another, with new leadership teams coming in, can attest to kind of the nature of change that can happen. I feel like an emergency, as much as the emergency room changes, nobody in emergency deeply appreciates change. Um, but yeah, like with major cultural shifts in ownership, what I noticed when when the previous hospital was acquired by by Veterinary Emergency Group, it was a volatile change. And admittedly, the previous culture, objectively speaking, like didn't necessarily have a lot of kind of influence from leadership to change the toxicity that was present in the hospital. There wasn't a ton of investment towards the staff from leadership for them to grow or to flourish in a number of ways. And true to kind of the emergency, kind of the ER culture in vet med, um, people are more likely to find a way to say no than to find a way to say yes. The biggest limiters are financial. Um, really, like if as in if an owner didn't have enough money to pay for something, I mean, it was a very simple no. Um, Transitioning to veg, I mean, just would be more likely to give financial concessions. Now we have ways to help our support team and our doctors, for that matter, to advance in their careers. We have the entire open hospital concept where we allow people to be with their pets at all times. But a lot of those things, especially that last part, having an open hospital concept made a lot of people really uncomfortable. We lost a number of staff members just because of that, because they weren't comfortable with the idea of being transparent, of being open. Um, and what I learned with this process was that the volatility of a cultural shift can be immense. And it often does require a big ideological overhaul for the more severe situations. And you may very well lose a lot of your team. We ended up losing kind of a number of our staff, it's about 4/5 of our team, because the transition was not severe, or as in the impact on them, but some people just aren't able to adjust. And this brings us back to our earlier point of assimilation. Being immersed in a certain type of environment for a really long time, uh, and if you choose to stay in that environment, one has to adjust, and to adjust often means to assimilate, to kind of attune one's expectations, one's ideologies to the space you're in. And a lot of the staff had done that. So shifting them out of that as abruptly as kind of a company shift would require didn't necessarily resonate with a lot of people. And this also kind of brings up another point where major cultural shifts, I mean, even if it's just like how you control your team on the floor at a given shift, if there is a very powerful kind of negative impact on the culture, uh, changing that requires kind of as much force in a way that not necessarily everybody will receive it well. So you have to be willing to take a little bit of heat if you're trying to change the culture. Like, it won't happen easily in all cases. And indeed, I feel like the transition from the old owner to veterinary emergency group for my hospital, the cultural transition in full probably took about a year and a half after the acquisition. Um, and not that it just took that long to replace people, but to change to cause people to flip gears or like flip that switch in their minds to function differently in a way that is required by the new entity, the new company. Um, yeah, it took people a really long time to acclimate to that. And that was for the best, at least as far as I can tell. So like kind of the lesson there is for better or worse, evoking change and evoking a change in culture is something that requires patience and it requires a commitment to the long term, to the bigger vision. Yeah, it's tough. Like a lot of ARs are losing, and I'll even track back to.
Great people, great people. They're losing great people.
And I think they're losing great people now, especially because people have somewhere else to go. I think each and every one of us in our own spaces can really only do what we can to change our immediate environment. Um, and I think it's also just it's really good to know that the importance of culture is now coming to the forefront and now becoming a major factor in a hospital's ability to keep a 24-hour ER or not. Because I mean, if nobody likes working there, they have places where they can go. And I think I really appreciate how, like in the past few years, the power in vet med is moving more and more towards the employees and moving away from the big corporations. And certainly at least the ones that aren't taking care of the employees. Alternatives are popping up. Yeah, and people don't feel so trapped where they are. Um, yeah, yeah. Mm. Yeah. By the way, this is the last one. This is great chat. I appreciate y'all. So the last point is culture has to be intentional. I'm thinking that's kind of goes without saying. Like everything that we've spoken about on this call thus far kind of suggests that. Um, and kind of running low on time too. But I'll say that the ways that there are a number of ways that we can each be intentional about culture, and I'll use intentional in a very like objective way. Intention can be good or bad. And we can think of a number of leaders that are good and leaders that aren't good. And ultimately, it's the leaders that define the culture. And we just have to remember, like Barack Obama is a leader, but so is Donald Trump. Like you can be a leader and lead people in any direction you want, but the ideals behind the way that you lead and the way that you choose to contribute to culture or drive it, it has to be driven by your internal compass. And ideally, it's in a way that kind of brings everybody up. Generally speaking, culture starts at the top. On a hospital level, the leadership teams, the hospital managers, the medical directors, various leads, um, they control culture kind of in a very top-down way. On the clinic floor during a shift, the doctors often have a high impact on culture, but ultimately anybody can have an impact on culture in a positive or negative way. The energy that you bring to the floor, the energy that you kind of bring to your lives in general, how you choose to interact and interface with people will have impacts on culture, either macro or micro. Um, and all of those kind of contribute to like the general mood and sentiment. Yeah, and just recapping on those principles of culture being it's intangible, you can't really feel it, but you know it's there. It can sneak up on you before you can put words to it, by which point you may already be in it. And then you have to just have a level of self-awareness to understand what you're in and then what to do about it. It's internal. It starts with you, you, me, all of us. And you have to make sure that ideally, hopefully, that where you are, your internal compass, how you're feeling resonates with the culture or with the environment that you're immersed in. Culture is inconstant. It can change. It changes regularly. Cultural shifts happen all the time. And change isn't a good or bad thing. By definition, or by default rather. And cultural change can happen in a good way, and those transitions can sometimes take some time. And also, lastly, cultural has the it has it culture is intentional as well. Everybody's impact on culture is whether they're aware of it or not, very intentional. Who you are, how you choose to show up, how you choose to interact, is all a result of who you want to be and how you want to present. Um, yeah, those are the main points. And that's my old dog. Her name is Nutmeg. But yeah, any questions about culture or comments, any more life experiences that anybody wants to contribute, are more than welcome. Um, And otherwise, yeah, I really appreciate everybody tuning in. Great feedback, Lenise. Great feedback, Anaya. And as always, Avery, appreciate you.